Hey guys, it's Christina McInnes. We are here at Dr. Workman's office. I'm a little nervous, but I'm also really excited. We are going to be doing cool sculpting today. I've been here before and I showed you guys the Botox, the lip filler, like you literally went through the whole process with me. And so I've been wanting to do cool sculpting for a really long time. My mom did it. I've had friends and family who have did it, and they all honestly had really different results. But that's where I feel like having the consultation and going to a reputable space is so important. I had a friend who did it and she went to some random space. It did not turn out well. So make sure that you're going to like a reputable spot. I really trust Dr. Workman's office and I feel super comfortable here and clearly super comfortable with you guys because I'm about ready to show you my stomach, the full midriff action. So we are really getting to it. Why I'm doing cool sculpting, it may sound like kind of crazy. I'm definitely like very body positive, but at the same time, that's been an area of my body that I haven't loved like forever, guys. Like since I was in high school, I was like 120 pounds and did not like that area of my body. It was like right when like low-rise jeans were in, things were not too great. And it was just a spot that like I've had the worst time trying to tighten. Like I can do as many crunches literally that I want to, and it doesn't change. And I like love some Sally Hansen tanner, but at the same time, like I just want to feel more confident and I want to add like that extra like level of happiness. And I think that, you know, having like a tight toned tummy, like who doesn't feel good about that? So I'm really excited, but also nervous. And I'm going to be taking you guys through the full process. So we are getting into it. We're going to get this party started and welcome Mikkel into the room. Cross your fingers for me, guys. Hey guys, so we brought in Mikkel and I have come in for a cool sculpting consultation. It was about 15-20 minutes. So I didn't just like walk up in here and get this done. This is treatment day, like I was saying. So we're just gonna go over some like typical questions that you guys might have. They're typical questions you go over during an appointment so you can kind of get the gist of what's gonna be happening here. So how long is a typical like treatment process?
Well, first you come in for your consults, which we did that earlier. A consult usually lasts about 30 minutes just based upon how many questions that you might have. We'll go over what to expect from the treatment and then also assess you just to see if you're a candidate for the treatment and set out a treatment plan based on your body and your goals.
So my major issue that I talked about, so you can have like so many different treatment options. Mine's like based in my lower stomach and then my upper stomach. What are some of the other places that you can get treatments at?
Yeah, so tummy is usually number one, but we also do the flanks, which is also known as love handles, the bra area, arms, inner thighs, outer thighs, knees.
Which I think is wild. Yeah. Like that's so
and
wild.
And the chin as well.
That would be an ideal thing. I might enjoy that one.
Next on the list.
Yes,
next one area and then we'll go from there.
What is like a typical cost? I know obviously there's so many different places and then you may vary, but like for you guys, what's a typical treatment cost?
Yeah, so treatment costs, we get asked that a lot, and it is hard to determine that without actually coming in for a consultation. It's based upon how much fat is held in the area, how many applicators, also known as cycles, is needed to address the area, and also your goals of what you want to see. There's different sizes of applicators. There's the mini, which is typically used for the chin, the knees, and the bra. There's the petite, which is used for the tummy and the flanks or inner thighs. And then there's also the Cool Advantage, equivalent to the size of my hand, and the Cool Max, equivalent to two of my hands put together. So it depends on the placement of those applicators. We're pretty, reasonable as far as pricing goes, but it is a medical procedure, so keeping that in mind. But average, I would say, just depends on the area. So tummy could be one applicator, it could be 8 applicators. So really coming in for a consultation just to set out a treatment plan for you.
Okay, so what I didn't know before this, guys, is like a thing that I want to share with you. So you pee out fat cells, correct?
Yeah. So, how it works is the scientific term is called cryolipolysis. So crystallizes the fat cell, apoptosis, it dies off. white blood cells take over, bring it up to your liver, ultimately pee out your fat cells.
Flush it
them
out, which is cool. I think that's cool.
So the great thing about it, it is permanently removing a portion of those fat cells. They're not going anywhere else. They're not regenerating. Only time you regenerate new fat cells is pregnancy or those that are obese. The cell can only hold so much content, regenerates a new fat cell. So permanently removing a portion of those fat cells.
That is so awesome.
Yeah.
So yeah, we're just gonna be, as I said, working on the lower section, and we will hop right to it.
Yeah, here we go. So first I'm just gonna wipe down the area. This helps protect the skin. We're just gonna wipe down. We're gonna start with this lower tummy. We're using the Max applicator that will help address kind of hip to hip here. So first wiping down. Next step, we're gonna take the sticky, slimy gel pad. And I always suggest patients wear something comfortable during their treatment time. These gel pads tend to get all over the place. It's sticky and slimy like honey. I'm gonna pull this out.
Oh, it kind of is.
Yeah.
It feels like a sheet mask almost, like a thick sheet mask.
Right, and then with these gel pads also, you can't get the air bubbles out, so what you might feel during the treatment time is just the vibration of the air bubbles popping.
Okay.
Some people are like, is it falling off or what's it doing? That's all that is.
Okay.
But this helps protect the skin as well. So next step, we're gonna take the applicator here. So when I attach the applicator, it's gonna feel like putting your hand on a vacuum hose, that pull, that grab, maybe a little pinchy in some areas. And then I'll start the cooling cycle once you're comfortable.
Okay.
The cooling cycle, 5 to 7 minutes of intense cold. I like the analogy of feet in snow, kind of that burning, tingly feeling.
Okay.
And then at about 10 minutes, you'll go numb.
Okay.
You can read a book, have a glass of wine, watch a movie, whatever you want to do during the treatment time. And then I'll come in and take it off, but I'll check on you frequently. So let's get this started. All right.
Okay.
Here's just the suction, so you'll just feel that first.
Okay.
Good, okay?
Yeah.
Kind of like a leech grabbing onto you. And then we'll just slide the boppy. This holds it into place. A lot of people are familiar with what a boppy is. And then I'll pull this over here, just make it comfortable. And then once you give me the thumbs up, we're comfortable and good to go.
Yeah.
Okay, I'm gonna start that cooling cycle and you'll feel that kick in.
Okay.
All right.
I'm like scared.
Oh, don't be scared.
Okay.
All right.
So guys, we're about 10 minutes in. I'm literally numb. I can't feel anything. But we did want to talk to you guys about like results and kind of like expectations, because I feel like a lot of people go in and they're like, this is liposuction, and I'm like, it's not liposuction. Like it's definitely more of it's more like a natural, it's a contouring method instead of like something where you're gonna go in and get like really like surgically under the knife, like getting
not a
into
tummy tuck.
C-section.
It's definitely more of a contouring, not a weight loss treatment. So you definitely have to be realistic as far as what you're going to get from the treatment. One session you're looking at 20 to 25% reduction, which may be happy with that, or you may want to readdress it for an additional 20 to 25. Coolsculpting is addressing the fat that's in between the skin and the muscle, that pinchable, grabbable fat. It doesn't affect visceral fat. Visceral fat's behind the muscle, pushes the muscle out, so it's hard to the touch. There needs to be something for the applicator to grab onto. So just think of how much fat that you have from skin to muscle. That's what we're addressing. 20 to 25% reduction. Of course, the second session, you're looking up to 50% reduction. The peak of the results are that 3-month period. It is a natural process of elimination, so it does take some time. But if you're looking to do a second session and you know for sure you want to look your best by summertime, you can come in and retreat as early as 4 to 6 weeks.
Oh, okay, awesome. Well, yeah, and I think that we'll be doing, like, should we say 2 sessions?
Yeah.
Yeah, so we'll be doing 2 sessions, so yeah, I'll definitely keep you guys updated too on results and like how I'm feeling. I've like watched YouTube videos and some people are like, whoa, they go week to 2 weeks and they're like, I'm totally seeing a difference. Like my husband's has seen a difference.
So all of that is based on your metabolism and how fast you process those crystallized fats. So I do sometimes get a phone call after 3 weeks of, I'm seeing a huge difference, I'm so excited.
Yeah.
But I always do suggest coming back in for that 3-month period follow-up and taking a look at your before and afters to see the difference.
Yeah.
Looking at yourself every day is like watching a tree grow, right?
Yeah.
You see it all the time.
Exactly.
So until you really look at those pictures side by side, you'll see a big difference. So we have about 10 seconds left. So once the timer goes off, I'll take the applicator off. You're going to be right in the area. The shape of the applicator might be a little stiff. going to be those crystallized fat just sitting there. I'm going to start to massage it. Might be a little uncomfortable.
Okay.
It is like massaging a bruise or a burn, but at the beginning I said analogy of feet in the snow. This is like taking a hot bath after. So kind of that burning, stingy feeling of it coming back to life.
Okay.
But studies have shown that 68% of the results you see are based on massaging it afterwards. So just think results in your head while I'm doing that.
Okay.
Breaking up those crystallized fats, your metabolism takes over and flushes them out.
Okay.
Again, some people are numb and don't feel anything, so don't be scared. We'll see what happens.
All right. I'm sure the look on my face is like priceless.
So this is a warm towel, kind of helps distract you. And then just breaking it up. Okay. And some people are ticklish too.
Yeah.
You never know what I'm gonna get until
Yeah.
I start massaging.
I have like hands on my hips right now. I like didn't realize I was doing it. Yeah, it's very it's interesting.
Yeah, and so you won't have to massage yourself once you leave here. It's just when I take the applicator off.
Okay.
There really is no restrictions once you leave the clinic. If you want to go work out, you can go work out. If you want to carry on and go to work, you can go to work.
Wow, so this is like a lunch break process.
It is. And then, again, the most common side effects after the treatment, though, is possible bruising.
Okay.
More so if you're prone to bruising or on certain medications that cause you to bruise. So it's like you did a bunch of crunches, just kind of tender to the touch. Swelling, which is the inflammation of killing off the fat cells, more of a bloated feeling. Not that anyone else would notice, but you can wear some sort of compression like the yoga pants that you have on, hike them up over the lower tummy, and that can help with any discomfort with swelling. And then numbness to the touch, that's probably the most common, and that can last about 3 to 4 weeks.
Okay.
But nothing that's going to hold you back, like I said, from
the day-to-day.
your day-to-day.
The day-to-day life. Okay, guys, we just wrapped up. It really didn't hurt. I would say the most uncomfortable part was like the rubbing action, but it wasn't for me. It wasn't like feet in the snow. It was just kind of like, you're just kind of like, someone's like rubbing my stomach. It's like, that's what they're doing. But yeah, it really wasn't bad. So now I'm going to schedule a follow-up appointment, which is typical in 4 weeks.
Well, in 4 weeks, we're going to do a second session. So exactly what we just did today. We'll take pictures again, then get you hooked up. And then you'll come back in 3 months from that appointment, and then we'll take the after photos and kind of discuss, the results and what you'd like to see if you want to go further or do other areas or maybe completely happy.
Okay, awesome. Well, thanks guys for tagging along. Make sure to follow Dr. M. Workman. That's where Mikkel works. And then make sure to be following me, of course, at Christina Catherine McGinnis. And thanks for hanging out and spending the day with us getting sculpted. Okay,
Bye.
Bye.